Thank you everyone for joining. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Greeting and a very warm welcome to our monthly webinar brought to you by the Institute of Public Health. I am Dr. Ali Ar-Rahman, Adjunct Assistant Professor in IPH and also an IPH alumni. I will be serving as your moderator for today's webinar. And it is this webinar that is part also of a global initiative. This is public health, the title of it. And it is dedicated to highlighting critical public health matters. And also we are very honored to have an affiliation with ASPAR, the Association of Schools of Public Health in the European region. And before we proceed with the webinar, we'd like to have some few housekeeping notes. Please feel free to engage by asking questions throughout the webinar by simply clicking on the Q&A option at the bottom center of your screen. And also, this webinar is being recorded and will also be available on YouTube channel on Institute of Public Health, College of Medicine and Health Sciences, alongside with the previous webinars that have been conducted. And also, I am pleased to announce that this webinar is accredited by UAE University as 1 CME Category 1. And following the session, you will find a link in the chat to evaluate the webinar. It's very important that your feedback, it's invaluable. And keep in mind, please, that upon completion of the evaluation, you will receive your CME certificate of participation. So it's very important to hear your valuable feedback. And now it is with great pleasure that we greet our experts in the field or distinguished experts in the field of public health that have accepted our invitation. And let me start by introducing our esteemed speaker, Prof. Eva Skuka. Welcome. Prof. Skuka is the Dean of College of Medicine, College of Health Sciences at the University of North Carolina at Pembroke. She earned her medical degree at the University of Tirana School of Medicine in Albania, and then also got a PhD in Human Services and Healthcare Administration from Capella University. She began her career as a medical doctor and later turned her focus to higher education, where she has served for the last 18 years. Prior to joining the University of North Carolina at Pembroke, Prof. Skuka served as the founding Dean of Allied Health and Special Advisor to the Senior Vice President for Nursing and Allied Health at Swedish College, NYC, as well as an Associate Provost for Academic Affairs and the Dean of the School of Health Sciences at Berkeley College, New Jersey, and New York. Her professional interests are in education and development of healthcare workforce, determinants of health and impact on health outcomes, as well as population health in rural areas. And most recently, Prof. Skuka served as a member of the North Carolina Medicaid Expansion Data Working Group, as well as the co-PI of the HBCU COVID-19 project. Prof. Skuka also has taught health science and healthcare administration courses at undergraduate as well as graduate degree levels. She is also a member of the American Medical Association, Medical Group Management Association, and American College of Medical Practice Executives, and as well as American College of Healthcare Executives. So the title for today's presentation is by Prof. Eva, is Interdisciplinary Approach to Public Health. Prof. Eva, the virtual floor is for you. Please start whenever you are ready.
Thank you so much, Dr. Al-Rama. Hello, everyone. It is a pleasure to be here. Let me just make sure that you can see my screen.
Yes, we can.
Okay, perfect. Just want to make sure I have multiple screens. So as I said, I wanted to start by thanking the Institute of Public Health, the organizers of this webinar series, for the opportunity to attend, and thank you to all of you for attending. It is an honor to be part of this health promotion series. The topic that I chose today that I wanted to explore is the interdisciplinary approach to public health. I chose this topic because I think that at the core of public health efforts is the commitment of the professionals to address health holistically, regardless of the level, whether it is at a local or regional, national, or global level of efforts. I strongly believe that in order for our efforts to have an impact to the population and communities that we serve, we need to address all health determinants and to promote health equity and build resiliency in the communities that we serve. So it is for this reason that I wanted to dive a little bit into this topic of interdisciplinary approach. Now, in this century, since the beginning of the millennium, the world has seen quite a few improvements in population health. We have seen a decline in mortality rate for children, almost 50% decline. We saw a mortality rate for mothers, maternity mortality rate dropped by 1/3. We have seen a decline in infectious diseases, including HIV, tuberculosis, malaria. The risk for non-communicable diseases have also declined. And overall, the global life expectancy at birth has risen from 67 in the 2000 to 73 by 2019. However, although there's a lot of efforts and a lot of achievements to controlling diseases, there's still quite a bit of work that we need to continue to do, because this century is facing us and is challenging us with different issues related to public health. And they range from issues related to the behaviors that are changing, the way how the societies are organized are changing, the disparities that we see in different communities with accessing care and the quality of care. COVID-19 pandemic also kind of put another challenge in front of us when it comes to health-related issues, because due to that service disruption, we now see that some of the indicators of health outcomes have fallen back. So I believe that it is very important for us to have a comprehensive understanding of the why, the what, the who, and the how part of public and population health. This understanding emphasizes the importance of our genuine understanding of this concept called health, as well as the importance of interdisciplinary approach to education of healthcare, of health professionals, interdisciplinary approach to research, and integrated medical, societal, and behavioral practices. So these are some of the items that I'm going to touch upon during this presentation. So the health as a concept has become more and more complex, or at least our understanding of the health has become more complex. There's different definitions for health throughout the years. They have ranged from a pure biomedical definition or physical definition to a little bit of more holistic definition that World Health Organization has provided. Now, what research has shown that traditional approach that health focuses on clinical care does not stand anymore. More and more research has shown that there's other determinants that play a much bigger role in health and health outcomes. Now, while medical access to medical care is extremely important, we have learned that health starts before any one of us needs medical care. Health begins with families and communities, and it is largely determined by where we live, where we work, where we grow old. So those social and economical contexts that weigh almost, they're responsible for 40% of the health outcomes, the variations in health outcomes, followed by another group, which is the healthy behaviors at 30%, and then the physical environment at 10%. So it is critical for us to look at what research and what our impact of our initiatives has on the different drivers of health. For example, research has shown that 44% of asthma in children is related to exposures, home exposures. Food insecurity plays a significant role in type 2 diabetes and the outcomes in treatment of type 2 diabetes. Low education, low income, living in impoverished areas, living in rural areas has also shown, multiple research has shown that impacts cancer mortality. And then social isolation is also associated with higher mortality regardless of the race. So this picture of what health is has changed throughout the years. The second why is the inequities and inequalities of inequity in access to care that different individuals have, and inequality, it has to do with the types of the quality of services that they receive. Now, I'm just going to provide a little bit of context related to the region where I work and where I live. The data that I'm going to share with you very briefly I'm quite sure that it's applicable to different nations, to different corners of the world. So I live in Robeson County in North Carolina. This county is only 80 kilometers, 50 miles from another county in North Carolina, which is Wake County. And I'm going to show you different slides to show how different aspects of health Robeson County falls way below to Wake County, which is, I repeat, only 80 kilometers away. So teen birth rates, 39 for 1,000 population compared to 11 in Wake County and compared to 21 in North Carolina. The STD rates are also higher. The 44% of households in this county are single parent households. 12% of youth, they are disconnected with the family. They live on their own. 40% have a little bit of college some years, and 62% live in rural areas. So this is a rural area where I live and work. Other indices, infant mortality, 11 for 1,000 population compared to 5 in the other county. Low birth weight, 12. And as you can see, all the indices of these social and economical factors, when comparing to very close by counties, show that Robeson County, individuals that are born in Robeson County, they grow up in Robeson County, and they may, spend the rest of their life in Robeson County, have less chances of having better health outcomes than somebody born not too far away. And as I said, almost every aspect, 15% of people will smoke living in this county, 15% have diabetes, 15% have they smoke, and 44% of the population is obese, compared to 28 in the other county. And the list continues. More homicides, more firearm fatalities, more motor vehicle deaths, and more drug overdose. As a matter of fact, the drug overdose is a major concern in this county. So overall, when you look at all of this, what that ends up is that a person that is born in Robeson County expects to live 10 years less than another person, than somebody else born in Wake County. So it is for these reasons that we need to dive very, in everything that we do in public health, we need to look at the multiple factors and how those factors impact different individuals, because not all initiatives and everything that we do will impact individuals equally. So another part that is important for us to understand is, so what is this concept of interdisciplinary approach? Now, there's different terms that, although they have some differences, they are used sometimes interchangeably, such as cross-disciplinary, multidisciplinary, transdisciplinary. So for the purpose of this presentation, I am using the term interdisciplinary to refer to the full spectrum of activities that span across multiple disciplines. So it involves more than one discipline. So if we go from Winslow's definition of public health, a leading figure in the development of what we know now, the modern study of public health, he almost, a century ago, he identified this important aspect of public health, which is the influence of the broader societal communal levels into the individuals, into the individual health, the individual level of health outcomes. Now, at the core of interdisciplinary approach is the embracement of the different dimensions of the health concept that I mentioned, and adoption of multiple perspectives to health outcomes. It also includes, the second factor is this integration of knowledge, perspectives, sources, and resources across multiple disciplines. And also tapping into the research and teaching and problem solving across multiple disciplines to create that ultimate outcome that we all aim at. I'd like to use a saying from Karl Popper, a very well-known figure in public health. He says that we are not students of subject matter. We are students of the problems. And those problems do not know boundaries. They could either fall right at the border between disciplines, or they could cross across the disciplines. So again, this interdisciplinary approach concept is, let's understand, have a very genuine, holistic understanding of health and what impacts health. Let's collaborate across the disciplines. Let's share resources. Let's engage in interdisciplinary research that will have a very strong applicable end goal, which is that of improving health outcomes. Now, the who of the interdisciplinary approach is really all the disciplines that impact this world of ours. Now, there's different concepts. You can approach the understanding of the multiple disciplines and which one of us is involved in interdisciplinary approach into public health. Some concept is you could go with bio complexity of our world, starting with the cellular level of the body all the way up to the ecosystems, or a more fairly newer concept is that of the One Health, which at its core is using multiple disciplines to impact the health outcomes of humans, but also by acknowledging that we live in an ecosystem, which includes the animals, and that ecosystem impacts us as much as we impact the ecosystem. So some of the disciplines range from epidemiology, from medical sciences, to biostatistics, to environmental health, social and behavioral science, occupational health, informatics, geology. So maintaining this concept that we're aiming to reach those outcomes for our communities, but we need to work together. Now, how is what we are all here about, sharing knowledge, sharing some, approaches. Now, based on my experience, based on my knowledge of the communities that I serve and are around me, there's three elements of the how do we approach interdisciplinary approach. The first one is we need to instill in our students during their education kind of instill the knowledge of interdisciplinary approach, but also develop competence for them to be able to successfully work with multiple disciplines. There's this saying that interdisciplinary practice comes or is engraved into interdisciplinary competence. And the competence, as I said, ranges from knowledge to skills to different values and attitudes that individuals that aim to work in this field should have. The other component is to have an integrated model for health services. So now we have educated them when they enter the field, they need to be able to integrate the model so the patient is able to seamlessly receive services for different aspects of those health determinants that I mentioned. And lastly is the promotion of interdisciplinary research. This comes with some challenges that we can tap a little bit during the Q&A session. But overall, the interdisciplinary approach or the goal should be to promote depth in the researcher so that the researcher not only has the credibility for the field, the discipline that they represent, but also that they can have, that broader look and look beyond their disciplines. Focusing on the grand challenge, which is improving health outcomes, equality, equity for everybody in our communities. So overall, my call for all of us here, whether you're students or whether you're professionals, is for us to embrace this idea of interdisciplinary approach to this field, to embrace and advocate for different initiatives or partnerships, whether it is in research or whether it is in practice, and overall for us to promote a culture of collaboration and innovation across disciplines in public health. So I'll stop here and I will be more than happy to answer any questions that we may have either now or further down this session.
Thank you very much, Prof. Eva. That was a very wonderful display of the importance of public health and how we can approach things and look at things. We'd like to keep the questions, if you don't mind, at the end. So
absolutely.
Okay, so our next speaker, our distinguished guest, Dr. Jeff Bolles. Welcome. Dr. Jeff joined Francis Marion University in fall 2024 as an associate professor of public health. Dr. Jeff received a Bachelor of Science degree in physical education theory and specialized in exercise physiology from the State University of New York College at Cortland. Also, he gained a Master of Arts in Exercise and Sports Science, specialized in exercise physiology from the University of North Carolina at Chapel Hill. Also, he gained a Master of Business Administration and specialized in financial services from the University of North Carolina at Pembroke. He has also gained a graduate certificate in finance from East Carolina University and a Doctor of Philosophy and Health Studies, specialization in health education and administration from Texas Women's University. Dr. Jeff research interests includes amyotrophic lateral sclerosis, which is also known as Lou Gehrig's disease, as well as health behavior theory and application, epidemiology, and health advocacy. Prior to his faculty appointment at Francis Marion, Dr. Jeff was the Assistant Director of the MBA program and a lecturer in healthcare administration, business communication, and finance at the University of North Carolina at Pembroke, a position that he held for 5 years. Dr. Jeff has also been an associate professor and department chair of healthcare administration at the University of Mount Olive from 2016 to 2019. He's also been an assistant professor and health promotion coordinator at the University of North Carolina at Pembroke from 2008 to 2016, as well as the head strength and conditioning coach, NCAA compliance officer, and lecturer at the University of North Carolina, Pembroke from 2003 to 2008. Dr. Jeff is also active in several professional healthcare administration and public health organizations. and is also a review editor for Frontiers and Public Health Education and Promotion, and has authored one book and several research articles. And finally, he presented at many national and international conferences, delivered webinars, and has served on 3 advisory boards. His title for the presentation is Public Health Policy and Advocacy, Creating Impactful Change. Dr. Jeff, please feel free to start whenever you're ready.
Thank you, Dr. Al-Rama. I appreciate you all having me with you today. I will begin to share my screen as soon as I can find the screen that I need to share. I apologize. I have, like Dr. Skuka, have many things open, and I thought the screen was relatively easy to find. There we go. We'll get this to come off. Okay, again, my presentation today is on public health policy and advocacy and creating impactful change. So thank you again for having me with you today. To introduce my topic, I would like to posit that we need to better understand advocacy and public health through a bigger understanding or better understanding of our biggest public health concerns, while also considering our best practices. In this presentation, I will look to identify the top concerns in global public health, and using those concerns, review current advocacy efforts, as well as expand upon the idea of those efforts to discuss how they can better be employed in a global perspective and improve overall global public health. The top concerns in global public health are infectious disease, such as, well, we'll see those again in the next slide, but examples of COVID, SARS, influenza, HIV, AIDS, as well as the threat of more pandemics. And we'll talk in just a second about Dr. Larry Brilliant and his TED Wish, which was demonstrated or presented in the early 2000s. And in that TED Talk, in that TED Wish, Dr. Brilliant discussed how a conversation with multiple epidemiologists suggested that we were primed for a global pandemic and that it would lead to death and prevalence numbers equal to what we saw in COVID. So very omniscient in that TED Talk. And I will actually put the link to that TED Talk if anyone is interested in seeing it. I think it's a brilliant TED Talk. If you have not seen it before, it is a brilliant TED Talk to look at from Dr. Larry Brilliant. And he was part of the team that actually eradicated smallpox from the world. So again, a very strong TED presentation from Dr. Larry Brilliant. Our second classification of concerns are non-communicable diseases, and we'll get into those further on down the presentation. Environmental health and climate change, and then finally, access to quality care. When looking at infectious disease, we, of course, are still acutely aware of COVID and have the concern about additional strains of COVID producing large-scale infection, although I'm sure we are now prepared to head outbreaks of COVID off before they become global emergencies again. But we also have the concern of long-term COVID and the long-term respiratory diseases that will be associated with that. We also have SARS, which of course is a close relative of COVID. And Dr. Brilliant in his presentation discusses how one of the models that we look at further on down was responsible for heading off SARS before it became a global pandemic. And then also, of course, we have influenza, a disease or that we deal with on a yearly basis with new strains. And of course, we have the different versions of influenza being swine flu, avian influenza, and what have you that we, again, have dealt with on global stages and have led to significant deaths. And then we have HIV/AIDS, and the United States was an excellent representation of the misunderstanding and cost of ignorance, really, of infectious diseases. President Reagan, back in the early 80s, was on television one time and gave a presentation where he suggested that HIV/AIDS was a gay man's disease, and therefore we didn't really need to worry about it as a country. Once that population died off, of course, the disease would go along with it. Obviously, that was a grave mistake and one of the biggest miscommunications in terms of epidemiology and public health in U.S. history. We, of course, have continuous threats of outbreaks and pandemics, and oftentimes, and again, Dr. Brilliant will share this with you in his TED Talk if you care to watch that. One of the biggest concerns with that is we are typically unprepared for global outbreaks. We are unprepared for pandemics. We are slow to react. And one of the mantras of his presentation is early detection and early response. In that TED Talk, he speaks heavily of the Global Public Health Intelligence Network, or GFIN. GFIN is a web crawler that was developed by an epidemiologist in Canada and is part of the WHO's Global Outbreak Alert and Response Network. GFIN was the web crawler that, using only 7 languages at that time, crawled the Chinese websites in Chinese, Mandarin Chinese, and determined that there was an outbreak of a disease very similar to avian influenza being reported not by public health agencies, but by people in general, and also being researched by those people as they were perusing the web for symptoms and treatments for the symptoms that they were experiencing. GFIN was able to find SARS well ahead of the manual public health reporting system where public health agencies would contact WHO with concerns about outbreak months ahead of the WHO's discovery of SARS. Unfortunately, GFIN was reviewed, and it was determined that it was, excuse me, not necessary, and so the system was shut down in May of 2019. And obviously that coincides heavily with the COVID-19 outbreak. And with GFIN in place, of course, we would have had a much more robust and much more early warning of the concerns regarding COVID and could potentially have headed off the outbreak similarly to what happened with SARS. After an investigation into some of the things that happened when GFIN was not up, and we had gone back to manual establishment of reporting, GFIN was reestablished in August 2020. Our non-communicable diseases, some of the most prevalent being obesity and overweight, cardiovascular disease, cancer, and diabetes, are diseases that are largely preventable. Yet in many countries, the absence of primary prevention, especially in the United States, is a precursor to these diseases being rampant and being endemic to many societies. So avoidance of these non-communicable communicable diseases would be greater and much better established if we were to emphasize primary prevention. This is the first point I would like to make beyond the communicable diseases needing a stronger web crawler and using more systems like GFIN. The first reference I would like to make toward advocacy. So avoidance through primary prevention is essentially the key to the limiting and decrease of all non-communicable diseases. A quick representation, a friend of mine has type 1 diabetes, and just yesterday I saw him again with a Starbucks Venti, which is the second largest size Oreo cookie crumble Frappuccino. And about an hour and a half after I saw him with it and gave him my advice that it would be better to avoid those and look for more moderate levels of energy and also cold drinks to cool his system, he reported that he was feeling very badly because his diabetes was taking full effect and his sugar levels had gone from the mid 100s to well over 360. So obviously, again, here with a better system, a better management, better tracking of his dietary intake of sugars, as well as managing his insulin a little bit better, he would have been able to avoid those ups and downs within his personal feelings of wellness. But more importantly, type 2 diabetes is a rampant disease across the world. And type 2 diabetes is most often caused by lifestyle and dietary intakes. So advocating for health behavior and advocating for public health education is paramount to changing behaviors and preventing many of the diseases that we see. Diabetes, of course, is obviously linked to obesity and overweight, but obesity and overweight is also linked to cardiovascular disease and cancers. So if we can advocate for better nutrition, better lifestyle, and more appropriate health behaviors, we can decrease substantially the overweight and obesity prevalence within the world, and of course, decrease some of these other non-communicable diseases. Because of that, we need to advocate much stronger for public health education. Public health education is obviously a mostly non-medical intervention to health concerns. It is, again, primary prevention, and it is an effort for those who are well-educated and fairly charismatic to go out into the public and provide resources for the public to be better knowledgeable of the different health behaviors that put them at risk. Efforts, however, are cut by or hurt by convenience as well as increases in sedentary lifestyle. As we have become a more digital and globally engaged population, we're seeing our young people, our students, our even our young workforce becoming increasingly sedentary, working in desk jobs, as well as obviously spending far too much time on electronic devices and using screen time. In my opinion, the most important aspect of public health advocacy is public health education. I would like to present a couple of examples of how public health education can be utilized and can be expanded throughout the world. And these, of course, are examples that are relative to my area, which is the same as Dr. Skuka's, Robeson County in southeastern North Carolina. This is a picture of a Wellness on Wheels mobile health unit. The University of North Carolina Pembroke School of Nursing has a very similar unit that goes around the community and provides health education screenings and other health services to the local community. But this Wellness on Wheels was actually a copy of a UNC Pembroke health promotion student from the 2008-2009 senior class. She actually won the first School of Business Entrepreneurship Award with her proposal for a workshop on wheels, and wrote a grant that allowed her to build the first workshop on wheels. There are several UNC Pembroke Health Promotion students in this picture, and this is a group that goes out and provides individual communities with workshops to help them better understand their health behaviors and how to augment those behaviors to improve their quality of life. Another example is another UNCP alumnus of health promotion, Ms. Brittany Melvin. Brittany is a great example of a different area that is often overlooked. She works more specifically with fire departments, EMS, and police departments to provide public health information, especially related to environmental health and safety, safety in homes, safety in cars, and what have you. You can tell by her very contagious smile that Brittany loves what she does. And you can tell by the excitement of the children that she is able to reach these children at very young ages and give them an opportunity to learn more about how to keep themselves safe in an environmental health capacity. So moving to environmental health, that is our third overall concern. And climate change, of course, we've got an extensive climate change being brought on by greenhouse gas emissions. That, of course, has brought about an increased intensity and frequency of powerful storms such as hurricanes, typhoons, tsunamis, earthquakes, and tornadoes. More importantly, we have the destruction of entire ecosystems, which is impacting our food supplies and animal populations. Many of our countries across the world are negatively impacted by the toxic water of these ecosystems, as well as the destruction of some of the more prevalent food supplies that are natural to those particular countries and locations. So it is paramount that we advocate for improved environmental health. And probably the most important or the greatest effort we can make here is to advocate for sustainable business. And sustainable businesses, of course, look at the triple bottom line. They look at not only economic impact, but also environmental and sociological impact, and focus on trying to improve all of those elements as they conduct their business. So with sustainable business, of course, we look to decrease carbon emissions, decrease waste, and increase efficiency. As well, we look to generate businesses that can, or products and services, sorry, that can have second lives. So we move from the concept of cradle to grave, where we typically build something to then throw it out, discard it, moving to more cradle to cradle or second life concepts where the product is created, used, and then turned into something else, whether that becomes biodegradable and becomes fertilizer for the ground, is able to be distributed to another group and used in a different way, is able to be recycled. Our final concern is access to quality care, and Dr. Skuka spent some good time on this as well. Without access to care and of course, good professionals who understand and do the right thing by our patients and by our population. Without that, of course, we have disease and illness that are uncontrolled. And access to care can increase the knowledge and literacy and overcome stigmas, fears, increase emphasis on lifestyle modification that I talked about earlier, and also improve compliance with medical directives, including prescription. One of our greatest concerns is, even in a society like the United States, where we tend to emphasize a little bit more secondary and tertiary prevention strategies, that when prescriptions or other services are prescribed, such as rehabilitative services, mental health, emotional health services, those things, when they're prescribed, patients do not follow the prescription and either misuse the drug or abuse the drug in such a way that it actually could become detrimental rather than doing what it is supposed to be doing, improving their health and treating their disease. So we need to increase our workforce. And by increasing our workforce, we're increasing their money supply, and of course also increasing the likelihood of their education. One of the ways that we can do this, and going back to the previous slide where we were talking about environmental health, is by, again, generating sustainable business. In third world countries, providing microloans for disadvantaged people. First world countries, providing aid to other countries that can help build orphanages and education facilities and community centers where people can go get help, as well as have an outlet for exercise and social engagement. We also need to advocate for decreased patient costs. In the United States, especially, pharmaceutical companies are able to maintain patents that go 10 to 15 years and then renew those patents with very small changes in the drugs, and thereby, of course, limit the access to generics and keep patient costs relatively high. We also need greater implementation of telehealth where feasible, even again in second and third world countries. Most have access to some level of telecommunication now, where telehealth could possibly be used to reach communities that are more rural, more disengaged from community health centers. And then, of course, increase the mobility of healthcare. We saw that with the workshop on wheels, but the RX for Survival documentary, again from the 2000s era, demonstrated excellent ingenuity in creating mobile ambulances that were motorcycle driven with patient bed on the side, where nurses could actually go out and provide care out in the outback and in the brush, as well as be able to transport patients who needed them, the transport back to the cities for more complicated or complex treatments. This is a reference to the GFIN site if anybody would like more information on GFIN. And I would like, again, to thank you for your time and for inviting me to present.
Thank you, Dr. Jeff, for the insightful presentation. You're touching on really sensitive places that we need to focus on as public health experts. So we'd like to open the room for questions now. So if you have any questions, please feel free to type them. We have already some questions mentioned in the Q&A box. Prof. Sheikh Hussein, it's really nice to have you here. His question is about, first of all, he thanks Prof. Skuka for this comprehensive presentation. And he's asking about the impact of COVID-19 on health inequalities globally and in the USA. What is your advice for the unknown pandemic to come?
Thank you very much for that question. So my response will present my experience in assessment during COVID on the northeastern part of United States. And then, just soon after that peak of COVID, I moved to North Carolina. So, and the study where I was a co-PI that we completed most recently looked at the inequities and inequalities in North Carolina, not just in Robeson County. We looked at different counties throughout the state. So I would think that the most obvious aspect during COVID, regardless of whether you were in the northeastern part of the United States or more southern, in the southeastern part of North Carolina, was the lack of access to care, lack of access to the prophylactic equipment and supplies. Then we saw an increased rate of COVID, infections in areas that had the lowest economic, status. That has to do with multiple factors, ranging from, most of the time in those communities, they do live very close by, so that increased the infection rate. Then you see in particular areas like rural areas, access to care was, made even more challenging during COVID because they don't have transportation to go to a hospital or to a clinic to receive care. Then when the vaccines became available, then we saw even more pronounced, that difference and inequality in access to the vaccines. So those were some of the aspects that, we observed in the United States, that we studied in North Carolina in our most recent study. And I do believe that these are applicable across the globe. Many communities experience similar difficulties and challenges during COVID. We also saw with the study, most recent study, we also looked at the impact of COVID on the comorbidities. We looked at the infection rate as well as the mortality rate in individuals that have comorbidities, and tying that in with their ability to have access to care, and as Dr. Bolles mentioned, quality care, right? Because there's a difference there. Now, the second part of the question was, how do we prevent, right, future pandemics? And I think the best, the first aspect that I could emphasize is to increase surveillance, as well as to increase communication internationally. It was very obvious in the United States that a lot of, especially in the beginning phases, the lack of communication from international community was very obvious. And I think it impacted a lot of policies and procedures that were put in place. Again, as I said, I saw the Northeastern and the locking down of everything, and then you have different approaches to that. What else? Strengthening the healthcare system is very important for the future. As I mentioned during my part of this webinar, I do believe strongly in that interdisciplinary approach to research, right? To have available vaccines, treatment, diagnostic tests, but also I wanted to also point out that the impact of COVID was not just related to healthcare. COVID impacted, Dr. Bolles mentions telehealth, right? So one of the aspects of, especially in rural areas, is that they don't have internet connection. So how will they have access to telemedicine? A lot of impact was seen in education, and I'm talking about population that were in colleges, they were enrolled, and they had to drop out because of the challenges and difficulties during that time. What else would I policy in general, looking at policy and governance and developing national and international preparedness and response processes would be something that, again, that's how the global community could face another pandemic like COVID.
Thank you, Prof. Eva, for your valuable insight. One quick question for Dr. Jeff before we conclude. We have 2 minutes. If you can please answer it within them. So you kindly have emphasized that primary prevention is one of the key factors to combat non-communicable diseases. So and you kindly have shown us an example, for example, the WOW van. It can include also secondary prevention. Would you also recommend such combination of these two types of prevention in these initiatives?
I am a strong advocate for primary and secondary prevention. Unfortunately, the medical model in the United States, and part of that is driven by the patient deciding to not seek treatment until disease becomes uncontrollable. But part of the problem in the United States is we're very tertiary focused, and if you look at U.S. health metrics versus just about every other well-funded country in the world, we rate very poorly, and a lot of that is due to, again, the paradox that we don't go for treatment before things get completely out of control. Whereas if we again focused on more primary prevention and even secondary prevention, the example of my friend, he has the drug, he has the insulin, he has an insulin pump, but again, he's misusing his insulin pump. Instead of using it appropriately, he's taking in high concentrations of sugar and then adjusting his pump to react to that. So again, there's a stronger emphasis there for using that medicine in such a way that he controls his symptoms prior to them becoming problematic. So yes, absolutely.
Yes, thank you very much. We'd like to ask you more questions, but we are out of time. We have really would like to learn more from you. We'd like to thank you so much, and we are really we extend our sincere gratitude to you, Prof. Eva and Dr. Jeff, for accepting this invitation and delivering this outstanding and highly valuable presentation. I would like to also express my thanks to everyone involved in this webinar and making it possible, including the management of our college and the UAE University. Special thanks to Dr. Afa, Dr. Azhar, Mr. Ismail, Mr. Al-Sajir, Mr. Amino, Ms. Bayan, and Ms. Khadija Al-Blushi, and Ms. Mariam Al-Niadi for their contribution and support. To our audience, thank you very much for your active participation. Please remember to complete the evaluation form or send the email if it is not working for you. And please make sure that you are connected to our social media accounts as shown in the slide here. And we look forward to invite you to the upcoming webinar on the 17th of September titled Biobank and Genome Project International Benchmark Analysis, as well as lessons learned from benchmarking analysis, which is presented by Dr. Jacqueline Hall. Thank you very much. Take care and stay safe, and goodbye.
Thank you.
Thank you.